have a heart condition that was acting up last year, and it got progressively worse until I was told about Dr. Ravi. And I emailed him. He called me immediately, and we spoke, and he said, it's going to get worse if you don't deal with it right away. So I literally dropped everything and got myself booked to come here. That's why I came to Hill City.
Dr. Rattray is an extremely interesting and a pleasant individual. He's a doctor himself from Jamaica. He was referred to us with for an ablation of atrial fibrillation.
My cardiologist, Dr. Mohammed, knew of it and told me it's the best place, the best. And Dr. Mohammed, by the way, travels a lot and reads a lot and goes to many conferences. And for him to tell me this is the best place, that was it for me. He did ablation therapy for arrhythmias I had. It was thought to be a certain kind of arrhythmia, which would be more serious, but when he went in the lab and did the stimulation, he said, no, you have this kind, the best thing I ever heard in my life. But he ablated some of the pathways. First he used RF ablation, and then he got close to a particular structure, so he used cryo. But he did ablation therapy for some abnormal pathways. I was born with these pathways, which as I got older manifested themselves as arrhythmias, rapid beats. When you do something, you feel it starting to stop. Because exercise is like it's threatening you. If you sleep in the wrong position, it's starting to threaten you. So I was almost an invalid. I couldn't do so many things, and I ended up in ER 4 times in 1 year. And I said, no, this is not working out for me.
Very interestingly, he turned out to have not atrial fibrillation, but a condition called AVNRT when we did the EP study. Which we could finally cure it with a kind of cryoablation, but not for atrial fibrillation, but for AVNRT.
I tell you, I do my research, and I researched before I got here. I actually typed in negative comments about this place. I couldn't find any. So I thought to myself, well, I'll find out when I get here. And it's very true. The staff smile at you, they're very efficient, you feel confident.
The good news for Dr. Rattray was it was not a condition like atrial fibrillation where there's always a chance of things coming back. And by doing the EP study and not going by the data from the past, we confirmed that it was not atrial fibrillation, and we managed to cure it completely using the cryoablation strategy, because with radiofrequency ablation there was a chance that there may be a complication.
I haven't been to any other facility like this, mark you, and therefore you might say, well, my experience is very limited, but I've read a lot and I have patients who have been to others, and I'd recommend highly, 100%. If anybody asks me, where should I go? I'm not going to say, come to Hill City, Cayman Islands.
So he was an extremely happy individual when everything was resolved and he was going back.
I have no complaints, and I recommend this place to anybody, anytime.